I'm going to wash my hands for 20 seconds per CDC guidelines with a knock. Introduce myself. My name is Gian. I'm going to be your nurse for today. How are you feeling? Okay, good. I'm going to be performing a head-to-toe assessment on you. Is that okay? Okay, great. Before we begin, I'm just going to check to see if your environment is safe and okay. I'm going to give you the privacy, pull the curtain, and I'm going to check your O2 and suction. Check the bed is locked in place. Check no clutter. Okay. I'm going to be asking you a series of questions just to make sure that you know. I'm going to check your LOC and also your armband to see if you are who you are. So what's your name? Okay. Date of birth? Okay. Any known allergies that you're aware of? Okay, great. Do you know what time it is? Okay, good. Do you know where you are? In the hospital. Okay, why are you in the hospital? You feel pain in your arm? Okay. On a scale of 1 to 10, what is the pain? 6? Okay, what's the quality of it? Is it throbbing? Is it painful? Is it sharp? Okay, do you know when this pain started? Okay. Do you know what aggravated it? What aggravates it? Okay. All right. So I'm just gonna check your vision, your vision, your hearing, and your speech. Okay. So I'm going to be checking your vision first. Can you follow my pen light here without turning your head? Okay, good. I'm gonna checking your hearing. Can you cover one ear for me? Recite 1, 2, 3. Okay, good. And then we're gonna cover the other ear. 4, 5, 6. Okay, good. Now I want you to recite 3 words for me. This is gonna be checking your articulation and if you are slurring. Okay, the words are light, tight, dynamite. Okay, great. I want you to remember those, okay? Because I'm going to be asking you those 3 words again at the end of the assessment, all right? So, patient appears to be alert and oriented times 4. Hygiene appears to be adequate. No signs of foul odor. Also, patient appears to be in good spirits. Okay, good. Now, let's begin assessing your head. It's going to be checking for hair distribution, any bumps, any lesions, any infestations. So far nothing, no abnormalities. Okay, now I'm going to be checking your hearing and your ears. Okay, good. Any redness, any signs of drainage, inflammation, stuff like that. Does it hurt when I do that? No, no. Okay, good. Now I'm going to be checking your neck. Okay. I'm going to be checking your carotid one at a time. And then the other side as well. Okay, good. Now I'm going to be checking your lymph nodes. No signs of swelling. Does it hurt when I do that? Okay, good. Now I'm going to be checking your thyroid. Trach appears to be symmetrical. No signs of swelling. Thyroid seems to be in normal size. Okay, great. Now I'm going to be checking your eyes. Sclera appears to be white. Conjunctiva appears to be pink. Do you have any vision, blurriness in vision? Double vision, stuff like that? You wear glasses? Contacts? Okay, good. Rechecking to see any signs of drainage. Okay. Now we're going to check Perla. Okay. Look through the ceiling. I'm going to cover your one eye. Okay, the other eye. Okay, great. Now I want you to follow it again without moving your neck. Okay, now look at the ceiling. Now look at the pen. Okay. Eyes appear to retract and dilate effectively. Now we're going to be checking your nasal passages. Septum appears to be symmetrical. Checking your mucus linings. Okay, good. Good. No signs of infection, no signs of drainage. Can you cover one nostril for me? Blow. The other nostril. Blow. Okay. Airways are patent. Now we're going to check your mouth area. Mucus lining appears to be normal. Okay. No signs of infection, no signs of foul odor. Okay. Now we're going to check your chest area. I'm going to first I'm going to inspect, see if there's any signs of lesions, any redness, any signs of infection or bulging anywhere. No. Now I'm going to be palpating your chest wall. Any feeling of tenderness? No. Okay. Now I'm going to be listening to your breathing as well. Well, let me put my... Okay. Every time I move it, take a deep breath, okay? Deep breath. Deep breath. Deep breath. Deep breath. Okay, good. No signs of wheezing, no signs of crackles. Are you a smoker? Have you used any tobacco recently? No? Okay. Do you have any signs of difficulty breathing? Okay, good. So now we're going to be checking your 5 landmarks on your, so on the right second intercostal, we're going to be checking your aortic valve, pulmonary valve, Erb's point, tricuspid valve, and your mitral valve. Okay, great. Now we're going to be checking your skin overall. Make sure there's no cyanosis. You'll be checking your arm here. No signs of lesions, hair. Hair appears to be normal. Okay, good. Now we're going to be checking your abdomen area. First, I'm going to be checking to see if there's any signs of distension. Have you had BM recently? Have you had any signs of, have you urinated recently? When was it? Last hour? Okay, good. No signs of distension. Does it hurt when I do this? No? Okay. I'm going to press a little harder this time, okay? No pain, no tenderness? Okay, I'm just going to listen to your abdomen, okay? I want to check your 4 quadrants here. Okay, bowel sounds appear to be present. Okay, good. Now I'm going to be checking your extremities here. Just going to inspect. Hair distribution appears to be intact. Hair distribution appears to be intact. I'm going to be checking your temperature in your skin using the back of my hand. Okay. Okay. We're checking your radial pulses. +2. +2. Brachial pulses. +2. +2. Now we're going to do range of motion. Can you move your wrists for me? Okay. Now we're going to move your elbows. So we're going to do your elbows here. No pain, no discomfort. Okay, great. Now I want you to lift your arms above your head and move your shoulders. Okay, good. Patient appears to be having effective range of motion. No signs of difficulty. Okay. Now I want you to squeeze my fingers here. Just want to measure your strength here. Okay, great. Now we're going to check your capillary refill on both hands. Very brisk, very brisk, very brisk, very brisk, and brisk. Check this hand. Brisk, 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 brisk. Okay, bilateral capillary refill is brisk, less than 3 seconds. Okay, now we're gonna turn you to your back so I can assess your back. Okay. So now I'm also gonna be auscultating your breath sounds. Okay. I'm gonna turn you this way. Okay, good. Now we're going to be assessing the back, see if there's any spine appears to be symmetrical, any lesions, any signs of skin breakdown. No signs of skin breakdown. Nothing on the sacrum, sacrococcyx area. Check the heels, make sure that they're okay. No signs of skin breakdown. Okay, good. I'm just gonna move this. Just gonna palpate your back middle area here. Make sure there's no signs of tenderness. Okay, good. Now I'm gonna auscultate your back now. Put this down here. Okay, good. Just gonna do the 8 points here. Okay. Take a deep breath. Take a deep breath, avoiding the bony areas. Breath. Deep breath. Deep breath, deep breath, deep breath. Okay, good. Now, we're going to be checking your lower extremity. But before we do that, we're going to just check your peri area, just making sure there's no signs of infection, foul odors, any redness, any tenderness. No tenderness here. Okay, good. And you said you had you urinated an hour ago, okay, right? Okay, good. So now we're just going to inspect your skin here on your legs and range of motion. Okay, good. Skin appears to be intact, no lesions. Hair distribution is intact as well. Okay. Now I want you to lift your leg up. Now lift your knee towards you. Lift your hip. Okay, good. We're going to do the other side. Up, move, up, towards you, around. Any pain in the hip area? Okay, great. No signs of pain, no signs of pain in the hip area. Okay, good. Now we're going to be checking your dorsalis pedis here, pulses, +2, +2. And then we're going to be checking to see your capillary refill. Okay. I'm going to be checking this capillary refill as well. And then we're going to be checking your popliteal, +2, +2. Okay, great. So, before we end the head to toe assessment, I'm just going to ask you a few questions. Have you had any plans of hurting yourself or others? Okay, good. Do you feel safe in your environment? Okay, great. Now, before we go, I'm going to ask you, do you need to use the restroom? Is there anything I can get you at this time? Do you feel pain anywhere besides your upper arm? Okay, great. Before then, I'm just going to check the vital signs that I checked on you earlier, and then we're going to see what your doctor recommends for your plan of care, okay? Thank you. I'm going to wash my hands for 20 seconds. Okay. Introduce myself. Hello again. My name is Guy and I'm back. I'm going to be checking your vital signs. Is that okay? Okay, good. So, just going to check your temperature here from your ear. Okay, 98.6. Okay, great. Now I'm just going to be checking your pulse here for 30 seconds. Okay. Pulse is 70. Okay. Now I'm going to check your blood pressure as well. Do you know your baseline? Okay, good. So just going to inflate the blood pressure pump higher than his baseline. Wait for the systolic and the diastolic. Okay, 120 over 70. Okay, good. Now I'm going to be checking your respirations. Okay, now I'm going to be checking your O2 set. Okay? Okay, now do you have any sensation of pain? Really? Where at? In the upper arm, upper left arm? Okay, what started the pain? What aggravates it? What does it feel like? Does it feel like it's throbbing? Does it feel like it's sharp? Does it feel like a dull pain? Sharp pain? Okay, so how long ago did it start? Yesterday? Okay, on a scale of 1 to 10. Okay, so your vital signs are done. Okay, I'm just going to be taking these to the doctor, and then we're going to, using my head-to-toe assessment and your vital signs, we're going to see your next, his next plans for you in terms of your care, okay? Thank you, sir.